are a paramedic trained in Pediatric Advanced Life Support. You are walking through the pediatric emergency department when you see a small child slumped over on a waiting room chair. His mother is frantically yelling at him. Your initial impression is that he appears pale with rapid and shallow breathing. He is not responding to his mother. She says the boy is 4 years old. 1. Your first action is to A. Establish unresponsiveness. B. Check for a pulse and breathing. C. Begin CPR. D. Begin rescue breathing. Correct answer A. Establish unresponsiveness by gently tapping the child and speaking loudly to him. You determine that the child is not responsive. You quickly carry him back to the treatment area and call for help. 2. The next step you should take is to A. Begin CPR. B. Monitor the victim until the AED arrives. C. Check for breathing and a pulse. D. Begin rescue breathing. Correct answer C. Check for breathing and a pulse. Complete these actions simultaneously in no more than 10 seconds. You determine that you can feel the child's pulse, but he is not breathing. 3. The next step you should take is to A. Monitor the victim. B. Open the child's airway. C. Begin CPR. D. Attempt to bring the victim up to a sitting position to provide a better airway. Correct answer B. Open the child's airway. Many times, providing a patent airway may allow the child to begin breathing. You begin ventilation with a bag mask valve device. You direct the technician to attach the cardiac monitor and pulse oximeter. You notice that the pulse on the monitor is 84 beats per minute. 4. The next action you should take is to A. Intubate the child. B. Start CPR. C. Give the child epinephrine. D. Continue with the assessment of the child. Correct answer D. Continue with the assessment of the child. You are providing effective ventilations to the child, and his heart rate is above 60 per minute. You begin the systematic approach to care. 5. This approach includes all of the following steps except A. Evaluate. B. Identify. C. Monitor. D. Intervene. Correct answer C. Monitor. According to the American Heart Association, this cyclic process includes evaluate, identify, and intervene. You begin the evaluation step in the process. 6. Evaluation includes A. Primary assessment. B. Secondary assessment. C. Diagnostic assessments. D. All of the above. Correct answer D. All of the above. During the evaluation, the clinician should do each of these assessments. You begin the primary assessment by taking vital signs and using the ABCDE approach to evaluate the respiratory, cardiac, and neurologic function of the child. 7. The ABCDE mnemonic includes A. Airway, breathing, compressions, diet, environment. B. Airway, breathing, circulation, disability, exposure. C. Airway, breathing, compressions, disability, exposure. D. Airway, breathing, circulation, disability, environment. Correct answer B. Airway, breathing, circulation, disability, exposure. The clinician should assess in that order so that the airway and breathing are assessed first. You verify that the airway is open and you continue to provide PPV using the bag and mask. You verify that there is no need to suction the child's airway since the rise and fall of the chest is symmetrical and unobstructed. His heart rate continues in the mid-80s, and oxygen saturation is 95% on 28% oxygen. He does not have spontaneous respirations. 8. The next step you should take is to A. Increase oxygen concentration to 32%. B. Decrease oxygen concentration to 24%. C. Maintain oxygen concentration at 28%. D. Begin CPR. Correct answer C. Maintain FiO2 oxygen concentration at 28%. The child's oxygen concentration is at a sufficient level at this concentration, so there is no need to make any changes. You auscultate his chest and note that he has some wheezing in his lungs. The child's heart rhythm is a sinus rhythm. Peripheral capillary refill time is approximately 2 seconds. When you pinch the child's finger to assess capillary refill time, you note that he attempts to pull his hand away. Pupils are equal and responsive to light and accommodation. 9. Your next action is to A. Begin the secondary assessment. B. Intubate the child. C. Begin CPR. D. Continue to monitor the child. Correct answer A. Begin the secondary assessment. At this point, the child is stable and does not require immediate emergency treatment. During this secondary assessment, you will do a focused history and a more thorough physical exam. During the focused history, you use the sample mnemonic to find pertinent information about the child's present condition. 10. The S stands for A. Start of condition. B. Signs and symptoms. C. Sleep pattern. D. Serial vital signs. Correct answer B. Signs and symptoms surrounding the current condition. A stands for allergies, M for medications, P for past medical history, L for last mealtime and content, and E for events leading to the current condition. Gradually, the child begins to open his eyes and pull at the positive pressure ventilation device. You stop the ventilations and note that the child has begun to have respiratory effort. You prepare to transport him to the pediatric ICU, where the team there is awaiting his arrival. At any time during this resuscitation, if the child lost his heart rhythm, a clinician should immediately begin CPR and use the cardiac arrest algorithm.